Hey everyone, Alyssa LeBrack, nutritionist and gut expert. I'm jumping in here tonight after taking a poll inside our free Facebook group, the Love Your Guts IBS support group. And after hearing endless stories over the years and being in practice, I've heard some of the craziest freaking stories of things that doctors have told their patients. And I'm kind of getting sick of it, to be honest with you. It is something that I personally went through. I see our clients going through it, our community going through it. And I want to be completely honest with you up front. Your doctors are doing their job, but their job is really limited. Their toolbox is extremely limited. And unfortunately, especially in North America, we have put doctors on a pedestal and been really taught to go through this cycle of you get sick, you go to the doctor, you get medication, you rinse, and you repeat. And the challenge is, again, when a doctor's toolbox is limited and you're banging your head on the wall, you're like, there's got to be a better way. This is where frustration really becomes next level because you're not getting the answers that you need. And most commonly, all your tests are coming back normal. They're telling you everything's normal. Meanwhile, you're shitting your pants, haven't pooped in a week. They're like, you're in pain. It's not okay, but everything's normal. So, oi. Here's the thing. Let me backtrack. Your doctor is doing their job. Their job is to diagnose disease. Cool. All right. They're also great at prescribing medication to help manage, keyword, manage your symptoms, right? They're also great for emergency situations and surgery. Let's not go there, but if you need to, they're great at lopping out gallbladders, for example. All right. So here's the thing. When you go to your doctor and they're doing different tests like colonoscopy, endoscopy, blood work, whatever it is, and they're telling you everything's normal, what they mean to be telling you is that there's no disease here for them to diagnose. It doesn't mean you're okay though. And it doesn't mean that you are the poster child of health. That's why you still feel like a bag of shit, right? Sometimes literally for some of you guys. So this is the problem with this whole system, is that you then get dismissed and sent home. In some cases, they will give you medications to manage your symptoms. For those that have constipation, you've been thrown Linzess, you're being thrown anxiety drugs, depression, antidepressant drugs, like all these different medications, omeprazole, all kinds of stuff. And it ain't working. And I'm going to tell you this right now. For those that have been on Linzess, we all know that it just gives you the shits, right? You've gone from constipation to diarrhea. That ain't working. That's not the goal. And so this is the problem. You go home. In some cases, you take the meds. In other cases, people will say like, nope, I don't want to go that route. And the doctors will sit and wait until a disease develops. Because that's what they work with, is disease, right? Or they'll wait until it's an emergency situation, you're having a gallbladder attack, and they want to lop out your gallbladder. Instead of noticing that you've got maybe, yellow film happening on your poops right here, right now, telling us that your gallbladder is struggling, you're getting pains, you're getting gallbladder attacks, why not reverse that? Now, instead of dismissing it for 6 months to a year, and then they want to just chop it out, right? So this is the problem, is the medical system is designed for emergency situations and management of symptoms from disease. It is not a system designed to help you prevent, dare I say cure, to, even prevent your symptoms from getting worse. That is really the big one, right? So, if you're looking for nutrition support, if you're looking for supplement support, if you're really wanting to stop your symptoms from getting worse and you want to address the root causative factor, these are things that doctors are just simply not trained in. And so it's like going to an Italian restaurant trying to order Chinese food. They just don't serve it. So this is where a lot of people, again, get frustrated. Again, it's not that the medical system is bad or wrong. They're just only able to fill in a certain need, right? If you're wanting to, again, do all these other things, you're going to have to tap into a different toolbox. And here's the thing, guys, it is so damaging, some of the terminology that doctors are using. This is where they need to do a better job. I want to try and pull this up here. I got distracted earlier and I forgot to pull it up, but I pulled the group this week, our free Facebook group, and I asked you guys if the doctors had ever told you that what you were struggling. Yeah, here we go. Has your doctor ever told you that your gut symptoms were normal? And this is so damaging and only is going to prolong your pain, guys. Some of the things that are happening here. So we've had people jump in here. And let me see here. Libya said, no, but the only suggestions I've been offered were to take laxatives, add more fiber, or take Imodium. None of these have helped. So then what's the plan, right? This is where we get stuck. Joanne said, she didn't say it was normal, but told me there was nothing wrong with me, even though I had lost 40 pounds in 5 months. That's not normal. Okay, my gastroenterologist told me that everyone has their own normal bathroom schedule, and if yours is once every 5 days or so, that's okay. Needless to say, I completely disagree with her medical opinion. And we even had someone else that jumped in here, and the doctor said the exact same thing, said totally normal if you only poop once a week or once in a blue moon, and then they did an ultrasound and in the same breath said you're full of poop. So that's contradicting. Guys, for the love of God, if your body is screaming at you with symptoms right now, listen to your body. Listen to your body and don't be afraid to advocate for your health. In many cases, when the doctors are saying it's normal, you just need to live this way, it's nothing you can do about it, what they mean to tell you is they don't have a fucking clue how to help you. That's the truth. Okay? Their toolbox is tapped. And they don't know how to help you. And instead of saying that, they're going to just tell you that there's no fucking hope. And that's not the truth. That's not the truth. Okay? There's no reason, if you're watching this right now, there's no reason why you can't feel normal again. And if it hasn't worked yet, it doesn't mean it's not possible for you. It means you're missing critical pieces of the puzzle. And there's a damn good chance that you're going to need to tap into other systems outside of the medical world to fill in those missing pieces and complement, not replace, but complement what the doctors are doing alongside. Okay, so let's jump in. We're going to talk about the 5 things that your doctor's not going to tell you, but I am. Okay, so the very first thing that I want to talk to you guys tonight about is that anxiety and antidepressant, like anxiety meds and antidepressants, these are not going to fix your gut. And so many people are being thrown antidepressants as a way to manage their IBS. And who here has been told by their doctor, I want to see you guys in the comments, who here has been told by their doctor that it's just stress? You're just stressed. It's just in your head and you need to take a fucking chill pill. That's why you're shitting your pants, or that's why you can't poop, right? And so what the doctors will do is tell you that it's all in your head, that all of your gut issues are not really a real thing, that you need to chill out. And so here, take these antidepressants. I mean, even if you had depression or anxiety, there's no shame in taking these medications first and foremost. Let me be crystal clear. There's no shame in taking these medications if you need them. And you also need to understand that the role of those medications are to manage the symptom. So they're not going to address the root cause of your anxiety or depression, even if you had it. It's designed to numb. It's designed to manage the symptom and reduce your ability to feel. And so if you have gut imbalances, all it's doing is numbing your ability to feel. It's not fixing the damage and deficiencies that are going on inside your gut and causing these symptoms. And so what tends to happen is now you've been given antidepressants, now you're dealing with the side effects of antidepressants, which are diarrhea, constipation, nausea, vomiting, fatigue. And now we've just created a snowball effect. And so now the doctors are doing more testing. And now you're going to be looking at more medications like omeprazole or some sort of proton pump inhibitor, antacid. And then they're going to start giving you more medications. Now you're dealing with medications to treat the side effects of your medications. Your IBS, your SIBO, your gas, bloating, diarrhea, constipation can absolutely be impacted by your emotions. But drugs are not going to fix that. Therapy is. Doing the dang work, right? Healing your trauma, working with emotional, like any sort of wounds that are going on. That's the stuff that we got to work on if that's the root. Okay, so that's the first thing. The second thing is you can prevent disease. You can prevent disease. The trick is to get ahead of it, not wait until we're in a diseased state, right? And so again, your doctor's job is to diagnose disease, and because they're not in the business of preventing disease, that piece of information is not going to be given to you simply because, one, it's not profitable, but two, they don't have the tools in their toolbox to help you prevent it. So please don't wait. Don't go home when the doctors are telling you your parameters are normal. All they mean is they're within medical range. So you get blood work done, you've got your medical range. These are your markers for disease. But within that medical range is an even smaller range called your functional range. You can be outside of functional range, but still within medical range. And if you're within these little markers here between functional and medical ranges, you're going to be symptomatic because it's affecting the function of your body. So they'll tell you, oh, your iron levels are totally normal, but they're not going to talk about it if it's low within the low range until you get to full-on anemia. Then you can barely function. So you can prevent disease if you have the proper tools. Don't let the limiting beliefs and limiting toolbox of a practitioner or doctor or physician be the determining factor on whether you can take back control of your life and feel normal again. You can prevent disease. Okay? The third thing is you can control your genes. And this kind of goes hand in hand with number 2. There are far too many people that are blaming genetics, that are like, well, Crohn's and colitis runs in my family. Guess what? Crohn's and colitis runs in my family too, but I didn't get dealt those cards because I stopped my severe IBS from getting there, right? I took back control of my life and I was able to redirect my genes. So this is a really cool thing, guys. You have the ability to control whether a gene is activated or not. And what controls the activation of a gene, meaning it turns on and says, okay, you've got a family history of cancer or diabetes or whatever it is, what controls whether that gene is turned on or not has everything to do with your stress, the foods that you're eating, the lifestyle that you're keeping, all of the boring stuff that no one really wants to work on. That's the stuff that controls whether your genes are activated. So if you're eating inflammatory foods, you are increasing your chances of those genes being activated. So this is the study of epigenetics. Well researched. This is not my opinion. Okay, epigenetics is strong and healthy and well in its research, and this is something that is not being discussed enough. You can control whether your genes are activated. And so please take back control of your life by knowing that you have the power. All right, number 4, your mind and body are absolutely connected. So this is such an interesting thing because our emotions are absolutely connected to our body, and we recognize that I'm going to say every other species on this planet we recognize is energetic. It's an energetic being of some sense, right? And we see this in animals, for example. It makes sense to us that animals don't yell at each other like, oh, danger's coming. They'll just all of a sudden sense danger, pick up on energy, and they'll run away, right? They'll run away from the danger. They didn't have a conversation about it. They picked up on the energy. They didn't even have to see that predator. They picked up on the energy and fled the scene. We have the ability to do that. We are energetic beings. In fact, we're more energy than we are actual substance of cells. And so this is the thing that you need to understand, is that your emotions are going to impact your body. Your emotions are going to absolutely impact your body. And the fact that the medical system looks at these two systems as completely separate, that your stress doesn't impact your gut, or that your stress doesn't cause damage and deficiencies in the gut, is such a short sight in helping people regain their health. And so if you are interested in learning more about that, I encourage you guys to read the book called When the Body Says No by Gabor Mate. So Gabor Mate. He's a Canadian physician who is educating and helping people understand how the mind and body are absolutely connected, and some of the research that really backs this. And he is actually shining a light on the shortcomings of medical doctors in the whole medical field. So your emotions and your body and your symptoms are connected. Let me give you an example of this. When we're dealing with constipation, typically with constipation, there's some sort of tight grip happening on life, right? When someone's struggling with constipation, usually this is a type A personality, someone who struggles to prioritize themselves, tends to put everyone else first, has a hard time saying no, is really someone who's trying to maintain control. Might be someone who's even really busy, has a lot of balls in the air. And so they're trying to have a tight grip on life to keep it all together. And that tension is actually contracting the rectum and keeping their bowels contracted and tense. And this is what's keeping them constipated. And there's a very real imbalance happening in the gut, because that stress that the body's being put under causes damage and deficiencies. It will deplete good bacteria, it will deplete enzymes, it will allow bad bacteria to come in and take over, and all of these will cause constipation too. And so we can't just supplement, we also have to fix how you're conducting yourself in your day-to-day life. Otherwise, you will remain stuck. And this is one of the reasons why so many people are taking all the right foods and all the right supplements, but not healing. It's because there is emotional work to do. All right. So again, your emotions and your body, your mind and your body are absolutely connected. Okay. Number 5. This is a good one. I'm going to give you guys a bonus one tonight. I'm going to give you guys 6. But number 5 is you probably have low stomach acid. Not too much stomach acid. You have a greater chance of having too little stomach acid than you actually have too much. Now, this is like the polar opposite of what doctors are talking about. Here's the problem. Doctors will hear you come in, you're like, I've got acid reflux, I'm getting this heartburn sensation, my stomach hurts, I'm constipated. Any sort of gut complaint that you've got, they will throw proton pump inhibitors and antacids at you like it's candy. It's dangerous. And here's the problem with this, is they're not testing your stomach acid levels. They're not testing your stomach acid levels. And I've had some people tell me, oh yes, they did, Alyssa. They tested it. They did an endoscopy, and they told me that my gut lining is inflamed. That's not testing your stomach acid levels. That's just seeing that your stomach lining is inflamed. And the doctors are assuming that that's because you have too much stomach acid. Never have I ever in all my years of practice seen or heard a doctor test stomach acid. They don't do that outside of their toolbox. And so here's the reason why it's so unlikely that you actually have too much stomach acid. The thing is, we're constantly being exposed to all these different stressors that deplete our gut. So if you straight up stress, busy mind, if you've ever had to take antibiotics before, if you're eating the same foods all the time, not drinking enough water, maybe too much coffee, even too much alcohol, not getting good quality sleep, giving birth to a baby is stressful for the body. And then there's things that are completely out of our control, like environmental toxins, travel, and aging. Aging alone, studies have shown that your stomach acid depletes as you get older. So why is it that we have such a large amount of population, especially older people, on some sort of proton pump inhibitor when there's actually a greater chance that they're low? That's a problem. And so let's say, for argument's sake, you actually have too little stomach acid, and then the doctor's gone ahead and put you on some sort of proton pump inhibitor or antacid. You are adding insult to injury. You're causing further damage, not you personally. This situation is causing more damage to your gut than good. And so we have clients that come into our Love and Trust Your Guts program who have been put on these antacids for years and years, and we test them and they're so depleted. They're getting raw, inflamed pain happening in their gut. They're getting acid reflux, Barrett's esophagus, burning in the esophagus. They're getting coughs and sore throats from having low stomach acid. And this is why we teach you how to test this inside the Love and Trust Your Guts program. Because if you're not testing it, you're guessing. And this is so dangerous, because if you guess wrong, if the doctors guess wrong, you could be doing more damage than good. Okay, so important. You have a greater chance of having low stomach acid than you do actually having too much. So let's get you tested. All right, I'm going to give you guys a bonus one. Here's the thing. If the doctor specializes in diagnosing disease, if they specialize in giving medications to manage symptoms or doing surgery, then that's very likely what they're going to recommend for you. And I hear this all the time. We have clients that come into our program. They're like, Alyssa, I keep going to the doctor and the doctor just wants to give me more medications. And I have a client we're working with right now. The doctor wants to permanently remove her intestines and give her a permanent ileostomy. So that's where the bowels are actually rerouted outside the stomach, and they live with a permanent bag where they eliminate their stools into. That's a serious surgery, right? So the chances are, if you go to your doctor, they're going to either recommend drugs or surgery. So if that's not what you want, why are you going back there? Right? Why keep doing something you don't want to do, you don't want to work with? That's all the doctor has in their toolbox. So just remember that. That doesn't mean that there isn't hope for you. It doesn't mean that there isn't something that you can do to heal this. It simply means that you need to tap into a different toolbox. And this is where we start to bring a more functional approach so that we can address the underlying damage and deficiencies that are causing your symptoms. So guys, the medical system is important. It plays a certain role, but that toolbox is limited. And so again, don't let the limiting beliefs and the limitations of someone's toolbox stop you from healing. Be an advocate for your health and don't ever give up. We've got you here. So if you need support, reach out and ask us questions. Come on into our free Facebook group, the Love Your Guts IBS support group, and we'll get you support and get your questions answered there. All right, guys, we'll talk soon. Bye.